Let's help us out a little bit with some of the things that are going on from the time they're 5 till they're aging out at 18, 19, softball-wise, that we would see them.
5 is easy. Taking care of a 5-year-old boy or a girl is pretty easy.
Yeah.
It's the adolescent years. Those are the years that are tough. And they're tough because, for both boys and girls, because they're trying to find themselves. But I think more so for girls because not only are they finding themselves personally and emotionally, but as they start through their puberty cycle, menarche, start having periods, it's a challenge because as a woman goes through her normal menstrual cycle, there can be some emotions that are there, and it's the social pressures, the pressures with friendship and fitting in and being part of the popular group, all play such a huge role for girls as they develop through their adolescent years. Softball is a wonderful tool to give them a sense of belonging, of group. And of course, exercise is phenomenal for people, boys and girls of any age, but very, very helpful for this point in time where they're kind of establishing their normal hormonal cycles, because probably the most difficult times for me as a gynecologist to take care of my patients is when their periods are just starting.
Right.
Premenarchal time, the perimenarchal time, and when their periods are just stopping, that perimenopausal time. The time in the middle, the reproductive age group, that's easy to deal with. It's the emotional turmoil that happens on both ends of that spectrum.
Right.
And with that adolescent girl, that's what we're dealing with, that emotional turmoil. Parents come to me all the time and they say, well, when should my daughter visit with a gynecologist? It's a pretty reasonable question. And the American College of Obstetrics and Gynecology has changed their recommendations a little bit most recently. And the recommendation now is age 21 or within 3 years of becoming sexually active, or if there should be a problem, obviously. Too much bleeding, too little bleeding, that sort of thing. Premenstrual syndrome that's just out of control, something we call premenstrual dysphoric disorder. So when something is very abnormal with respect to the menstrual cycle, then, of course, that becomes an issue, and they should bring their daughter to see the gynecologist.
Right.
And any pain, so those are common sense sorts of things that would make you go to see the physician anyway.
Does it, so psychologically, or literally, physical changes are taking place with hormones that will make them feel and act differently. And it's important for the parents to clue the coach in sometimes, and the coach, I like to use words that Dennis Forte used. If you're going to be a coach, you have an obligation to become a student of the game. And you also have an obligation to be a student of your players. And an obligation it's beyond softball, teaching them life lessons and paying attention to what you're seeing and hearing, and acting and teaching and coaching appropriately at different ages, but at different times for the softball player. So it's a good idea for the parents to clue something's going on in her life. Maybe a boyfriend disappeared. She didn't do well in school the last semester, or she did super good, but nobody likes her because she did too good. She's too pretty. All of those things, when those kinds of problems are coming up, the coach has to be tuned in. He has to be a good listener, encourager, on more than just softball.
Well, my daughter loves Dennis Forte. He was her hitting coach. And many times we would go for the coaching lesson, and incorporated in that lesson were discussions about school. Discussions about, hey, what's bothering you? What's bugging you? Your swing's off. What's going on?
Right.
Even to this point in time, of course, as I said, my daughter's graduating on the 22nd of this month. But to this point in time, up until this point in time, she would want to talk to Mr. Forte about her swing. She would want to come and just get it tweaked just a little bit if it wasn't working well. So, yes, I agree with all of those things. That, again, we go back to the first statement I made about that confidence-building, positive reinforcement. It is so important. And the coach needs to be tuned in to the playing capabilities, and also the background psychosocial, emotional things that are going on with his players or her players.
Right. One thing that I would say that, we, as parents, we've always gone through that whole cycle of walking to school, in the snow. Every day it snowed.
Uphill both ways.
Uphill both ways. And I think that a lot of times that the parent detaches themselves from the child's everyday problems because they've been there, done that, and they're not relating to the child going through that for the first time, and that perhaps that what seems like a little problem to them, to us, is monumental to them because they only have 2 or 3 things going on, and if 2 of those 3 things are in, Deep Space Nine, there's an issue. So I think we're also talking to the parents that as much as the coach is the guardian of your child when you're not there as a parent, from an athletic standpoint, how she's feeling has a direct result on how she's growing up, but a direct result on how she's also going to go to practice with attitude, and what her abilities will be that day or that week.
Absolutely, not even a question.
So the parents, I kind of, you don't want to preach to the parents, but everybody already knows I already do half the time. But it's to the parents, you've got to be paying attention too, and you've got to clue the coach in. We're gonna talk about some more stuff, but John, you and I were talking before, and we were talking about injuries to softball players, and it all goes back to covering to prevent so many of these injuries. There's 2 types, but one is very preventable. What we should be doing before we start to do anything. And talk a little bit about, because I've got everybody to do this, and let's talk about it from a professional's viewpoint on this whole warm-up deal.
Well, what I like, what we hear here about softball, what you're talking about with educating the parents, educating them so they can do a better job with their children. Mm-hmm. We live in the Northeast. Mm-hmm. We play softball in different temperatures, especially in May.
Yeah.
To help prevent injuries, you do want to warm up. Mm-hmm. And warm up is stretching and is warming up the muscles and so that they're ready to work real hard. Softball, once the game starts, softball is very competitive now in this area. Once that game starts, everybody wants to cross home plate. And before you can cross home plate, you've got to run all the bases. Right. You may not be doing it because you hit a ball over the fence and you're going to jog around the bases, but you're going to sprint hard to get to first base from a dead standing still position at home plate, as well as a fielder who's charging a fly ball or ground ball. So there's quick bursts going on there. You're asking those muscles to react immediately, full speed, full power, and that's where the injuries occur. Besides the fact that you're going to get hurt possibly from sliding or running into somebody, just from running without touching anybody, you can pull a hamstring, pull a groin muscle. So warm-up is important. So stretching, warming up, they can't leave that out.
Right, ever.
They absolutely can't leave that out. And the colder the temperatures, the more you have to warm up for a longer period of time.
Right.
If it's 80, 90-degree weather you're playing, you're not going to have to warm up as much because the muscles are already warm.
Right.
And so a little bit of stretching, a little bit of movement, a little jog around the field is good. But if it's cold out, you're going to jog around the field more than once to get warmed up. You're pitching, you're throwing. Softball can give you injuries from the shoulder, the arm, the elbow, the wrist, and obviously the leg, the lower extremity. So they're going to do a lot of throwing, so they need to warm up the muscles around the shoulder, elbow, wrist by throwing the ball and warm up. A good rule of thumb on any activity is to mimic the activity that you're going to use to warm up. So if they're going to be, obviously the softball pitcher is constantly warming up between innings and throwing the ball. You're going to find the pitcher on the sidelines near the dugout warming up before she goes out. Right. The rest of the people are playing different positions, and they're going to require a little bit different things in the field. Somebody in the outfield is going to be running a long distance to sprint and try to catch a fly ball. Sure. Or chase after one that may have been hit over their head. Right. And then they're going to take that arm and throw full speed to try to get that runner out, and it may be the cutoff, or they may have a great arm, they're going to be throwing to a home. Yeah. So warm-up's important, so they don't hurt their shoulders, they don't hurt their elbows. And I think today people are well aware of that, that you need to warm up. But do they forget? Yeah. And what you coaches are doing, reminding the parents to do this is important. And that clearly helps prevent injuries.